Thank you very much for having us. My name is Ron Hirschberg, and as you said, I'm a rehabilitation physician in Boston at Mass General Hospital and home base for veterans and military families. And I have here my colleague, um, Andrea Leiner, who is Deputy Director of Global Health Medicine. I'm going to go to the front here. Global Response Medicine. And thank you for having us. We think about you every single day, and it's really an honor to be here with all these colleagues. And we can't do this alone, of course. We were over in Kyiv in March and had sort of a very powerful experience and inspirational, and we're in this for the long haul. And I'd like to introduce my good colleague, Andrea Leiner, nurse practitioner, who has been really helpful in this whole process of partnering with us to make sure that we can connect with all of you. So I'll give you the floor, Andrea.
Thank you. Thank you to everybody for being here at the end of a long second day with great information. So today's presentation, we're going to focus on the invisible wounds of war, traumatic brain injury, post-traumatic stress, and other related conditions. And we also want to acknowledge that while these are called invisible wounds, we know that they're very visible in your daily practice. Next slide. GRM is a veteran-founded humanitarian medical NGO, and while medicine is core to our mission, leveraging veteran experience to do so is another part of our central ethos. And our founder, Pete Reed, was actually killed in Ukraine a couple of years ago as part of that mission. Next slide. Last year, Chairman Mikhailo Radutsky of the Parliamentary Health Committee highlighted to us the critical need around brain health for soldiers and veterans. Because warrior and veteran health is also at the heart of our mission, we connected with Dr. Hirschberg and our colleagues at home base at Mass General, who are leading specialists in brain and body health for service members and their families. And we created a program to link their expertise with yours, sharing lessons and also trying to avoid some of the mistakes that we made in the US, where over 150,000 veterans have committed suicide since 9/11. Next slide. The Invisible Wounds program was launched over the last 6 to 9 months. You can go to the next slide. And over that time, we held 4 weeks of in-person academic and clinical cross-learning at Mass General Hospital, home base, Spalding Rehab, MIT, and Harvard in Boston, and then also at the Ministry of Internal Affairs Main Medical Hospital and the Mental Health Hospital here in Kyiv. Your colleagues and clinicians led discussions on frontline realities and treatment advancements that you guys are making, while our US colleagues focused on sharing emerging research and technologies so we can all work together to improve patient care. Next slide. As you guys know, the challenge in Ukraine is enormous. Returning soldiers to duty is often a matter of national survival, and no country has ever attempted brain health care on the scale that you're doing it during an ongoing war. The operational tempo, the data limitations, and the resource constraints are real, but so is the urgency and the expertise in this room. So I will turn it over to Dr. Hirschberg to get into the science and expertise behind it.
Well, thank you very much, Andrea. As you see here, this is, as always, an older number. As the numbers increase for the casualties every single day, we know that GRM's expertise over the last few years is really stopping the bleed, so to speak, and helping Ukraine and other countries make sure that the acute care needs are met, as we learn from people on the ground, of course. We know that this number not only increases, but as we hope and pray that the war will end soon, we know that after the war, as Dr. Hermans and Ava Regal and others have mentioned, this is unprecedented amount of resilience and PTSD and brain health treatment that will be required for soldiers and their families to not only years but decades to come. And I'll just briefly say that home base has been around since '09, and the majority of the patients are veterans and families that have been affected by the post 9/11 conflicts in 2003 and beyond in Afghanistan and Iraq. As Andrea mentioned, there's been successes, but there's been pitfalls, and there's been a lot of two steps forward, one step back with the care and the treatment. And sadly, we've had many suicides, roughly 20 a day remain in the United States. So we know what's ahead, folks, and we want to try to get left of that and try to avoid some of those issues, of course. We focus on clinical care that we'll get to in a bit. We focus on wellness and resilience and physical and mind-body health. You know, part of our part of our ethos is really about how do we translate what we've learned and over 15, 16 years to help others in their situation. So try and go to the next slide. Sorry. There we go. One of the programs that we focus on is getting active duty veterans, about 75% of the 1,000 that we've seen over the past 4 or 5 years, 95% get back to active duty. Now, we know that is very different than the front lines within your own country during a war zone. That being said, we are looking to the future. We think about brain health as not only the signs that you will typically see from concussion, from PTSD overlay, from substance use, from depression, anxiety, and the list goes on. But we know that the body, especially we focus on special operators in this program that have had the most kinetic deployments, have had the most trauma over much of the military. And so we focus on a week of comprehensive care where they come in and get assessments in neuropsychology, rehabilitation, psychology, psychopharmacology, and imaging and labs as we really try to get everyone around the table in an interdisciplinary way to be efficient and to make sure that we can extend not only lifespan, but what we and the world knows about as health span, to make sure that once the war is over and once there's some stability, there's an ability with resilience and with other medical interventions to make sure that the life is not only just longer, but it is has a quality of life with less disease and less trauma. Now, over the years, we've seen some improvements with folks that come in. Like I said, 95% return to duty. Our PCL5 and our PHQ, so post-traumatic stress scale and depression scale, respectively. We've seen that before the program, there's been, as you see down the bottom left-hand side, a moderate to mild amount of post-traumatic stress, and then a significant decrease in depression. We've also seen that with working with our operators specifically, the neurobehavioral symptom inventory for concussion has decreased those numbers, that level of severity as well, from before the program to after. The signature program at home base has really been the intensive clinical program that started in 2017. And we bring in folks from all over the country that come in for a 2-week program. It's intensive. It's 7 a.m. to 5:30 p.m. Evidence-based treatment with prolonged exposure, cognitive processing therapy, with a lot of work every single day, cognitive rehab, physical therapy, speech therapy, and the arts are all utilized in this space as well. And part of this is really about talking about moral injury, like Ava was talking about, and also about the fact that PTSD is very tied into other aspects, and as we know in this room, that there's a Venn diagram really when you think about brain injury and PTSD. There's a lot of common symptoms, and so part of that is really teasing that out with the team. With a lot of group activities, everything from the arts to exercise and yoga. Our resilience program is really about stress management and mindfulness. Cognitive health, in vivo exposure are all things that have been developed over the years. And like we mentioned before, this did not happen overnight, and we've had some successes overall. I want to emphasize the family. It's something that we know that when war affects the soldier, it affects the entire family and extended family, and certainly the kids. And so we have launched resilient programming for youth, and that's online, and we've built these resources over the years. When it comes to the intensive clinical program, we've seen more than 2,000 patients over the years, and there's a very high retention rate. We've seen that the PCL or PTSD score has overall gone from moderate to severe down to mild to moderate, and the PHQ depression score has gone before the 2 weeks to after the 2 weeks, moderate down to mild to moderate depression. This is a familiar sight, of course, and we know that as the war goes on, the drones increase. In the last year or so, it's been dramatic. There's much that we do not know, and we know that the Ukrainian clinicians and military community are learning more and more every day about what drones can do to the body and mind. And this is a new ball game. This is a new frontier in drone warfare, and a new warfare for wars to come. As you know, the cheap FPV drones are wreaking havoc on the front lines. Up to 70% of injuries that we're seeing are now due to FPV drones, and there's a lot here, of course, to unpack. I did want to highlight that Colonel Kuziv, who has just published a really landmark, important paper. I'll show some highlights here. Is that a lot of the combat-related deaths and injury are of course related to head and neck injuries, even limb injuries resulting in amputation, as you know. And acubarial trauma, which is the inner ear trauma that can occur, is very common, and actually we're seeing more vestibular injury because of this. Still happen, but maybe less common, are burns and toxic exposures. And we know that most of these injuries are all include acubarial trauma. So I think something to focus on. I wanted to mention too that with post-traumatic stress, there's so much that we do not know about the sound, about the different exposure to the humming of the drone, to the approach of the drone. And how do we think about therapies, assessments and therapies not only from a pure clinical standpoint, but from an imaging standpoint and others, how we can best partner to really understand the future of how do we dampen down that PTSD and certainly how it affects depression and suicidality. In closing, we started as a very small operation at Mass General in 2009, and we've grown over the years. We are partnering with other states in the United States and working on innovation every day. We're very lucky to work with the Harvard Medical School system and branches from there. As you can see on the right side, we're currently partnering with Britain and Israel as well as Australia as far as the type of care that we provide. And of course, in this setting, we are really humbled and honored to work in some way with all these amazing people in the room and on this call to help in any way going forward. I want to thank you for your time.
Yeah, and I'll just, oh, go ahead.
Go ahead.
No, I was just going to say, with the support of the Parliamentary Committee on Health and Ministry of Internal Affairs, we are shortly going to announce the next phase of this program, which is going to be a project that is going to work on advanced diagnostics, treatment, and research within brain health and PTSD, with a focus on drone injury for both defenders and their families. So if you're working in this sector and you would like to connect on that, you've got both of our contacts up there on the screen. And what we're looking to do is link all of the good work that's already being done in country with international experts to start really focusing on advancing the diagnostics and treatment around this. So thank you so much for your time, especially at the end of the day.
Товариство, давайте подякуємо нашим.
Dear friends, a loud round of applause for speakers while they are still connected, while they can hear us. And let us move on and proceed with